Hi, I want to talk for a minute about knee degeneration, knee arthritis, and how it develops. The main problem is as we age, we get an old injury that we had maybe when we're younger. When we're young, we have plenty of cells, stem cells, and healing factors in our body that our body can reassemble joints and actually heal in a fantastic way. You remember when you were very young, 18, 19 years old, you get hurt and you just seem to bounce back. Even major injuries, you can get perhaps some sort of repair if it needs a surgical repair, or even if not, rehabbing it gets fantastic results. As we age, every decade we're alive, we only have about 10% of the previous decade stem cells. So we hit age 40, 50 years old, maybe 60 years old. All of a sudden we get these injuries. They just don't seem to get better. Instead of getting better and regenerating and healing the way it's supposed to, they actually go through a process of breaking down and getting worse. So I have a model here, and as we look at the model, you'll see that the model goes from here's a healthy knee all the way to a severely arthritic knee. I'm going to pull some of these out and explain the different structures of the knee. When you look at a knee joint, what you're going to see is this is the smooth cartilage that allows for motion. It's like glass. It's very slick and slippery, and it allows for the knee to bend forward and backward in a smooth gliding motion. Also, you have a cushion that sits between the top bone and the bottom bone called the meniscus. You've heard of meniscus tears, meniscus injuries. That is this cushion right there that can tear. You can get injuries into that meniscus area. Now, once that degenerative process happens, the first stage is it begins to affect the smooth cartilage. You can see the smooth cartilage starting to get some level of wear and tear. You're wearing through the smooth cartilage, and now instead of moving like it's supposed to, like slick ice, now it grabs or catches, causes pain, inflammation. As that continues to get worse, it starts to affect more areas of smooth cartilage, and you start to see the beginnings of bone spurs on x-rays. So you'll begin to see some of these early stages in the damage to this cartilage. You won't see that on x-ray because it hasn't affected the spacing yet, or the meniscus. Now, as it continues to progress, this meniscus will begin to get thin. That cushion begins to get thin, and the spacing gets thinner and thinner as time passes. And it eventually gets to the point where now the meniscus starts being thin. We see bigger spurs, more damage. As we open the joint, we can see that this meniscus might be torn. It might be worn out. It gets thin. That spacing gets thin on x-ray. And this is where people are coming in telling me, they've gone to doctors and they've taken the x-rays. They've discovered that there is that thinning that's been occurring. And instead of having a regenerative approach, they utilize cortisone. Now, cortisone is very, very good at reducing inflammation. There's no doubt about it. It can reduce inflammation very quickly. That's why they use it on the football fields. It gets a quick result. The problem with cortisone is typically it doesn't last more than about 3 months, and cortisone is degenerative in nature. In other words, it will break down the underlying tissues. So instead of your body healing the way it's supposed to, those underlying tissues, the arthritis can sometimes advance and get worse. And unfortunately, the approach for many doctors has been in the past just throwing multiple rounds of cortisone at the problem until the degeneration is so bad that you need a knee replacement surgery or some sort of surgery. We're going to go clean it up. Or perhaps you've heard that before. There's a new approach. The approach is stem cells. Now, stem cells have the ability to not just stop the degeneration where it's at and just reduce the inflammation. They have the ability to actually reverse that process, allow your body to heal the underlying tissues. Now, if you have a tremendous amount of bone-on-bone degeneration, we're not going to give you a 20-year-old joint again. The cool thing is we can actually create some separation, create some tissue in there, and bring relief. For sure, heal the smooth cartilage, and sometimes even generate some cushion in the meniscus itself. So if that's it in the really, really late stages, we can do that. And especially if you still have good joint space, we're getting some amazing outcomes. And we're getting people back to doing things they enjoy again. On your pickleball or your golf or your surfing or whatever it is that you're missing out on, you don't need to just submit to multiple rounds of cortisone and then a surgery. Come and get it looked at. See if you're a candidate for regenerative medicine, for stem cells. You might be able to get this better with your own tissues, with your own healing process, And we've been doing that for now over 3 years. We've taken care of over 100 patients, and we were seeing some amazing outcomes. We're getting 85 to 90% of the people that come in that we accept as patients are getting an amazing outcome from the regenerative medicine, the stem cells that we're using, and the other products that we use to help regenerate and truly heal the joint rather than just masking the symptoms until the surgery. I hope that helps. A little educational video on knee degeneration and some natural good approaches to how to fix it. Have a wonderful day.